Welcome to the GE Tech Aspire module on imaging techniques for screening blood vessels. This module elaborates on various angiography techniques commonly used in radiological practice. These include computed tomography angiography, magnetic resonance angiography, and conventional angiography. Before proceeding, read the listed learning objectives. Let's begin the module with an overview of arteriography. Arteriography is an imaging technique employed to visualize the arteries in the body. Most often, visualization of the arteries involves the injection of contrast agents into the blood vessels. Depending on the modality of imaging investigation used to visualize the blood vessels, angiography can be computed tomography angiography, or CTA, magnetic resonance angiography, or MRA, or conventional catheter-based angiography. Arteriography is useful not only for diagnostic purposes, but also for therapeutic intervention. Some of the common applications of arteriography are detection of abnormalities in blood vessels, such as aneurysm, stenosis, arteriovenous malformations, thrombosis, tumors, hemorrhage, inflammation, and assessment of invasion of tumors into blood vessels. It can also be used for interventional procedures, such as dissolving a clot, placing a stent in the blood vessels, and delivering medication directly to the tissue or organ for treatment, such as clotting medications at the site of hemorrhage or delivering cancer medication directly to the tumor. Now, let's discuss venography. In principle, venography is quite similar to arteriography. Venography is a technique of visualizing the veins within the body. This may involve the administration of a radiopaque dye into a vein and obtaining the images using X-rays. Venography provides exclusive details of the venous system in the body. It is used to assess the status of the vein and helps in the determination of blood clots within the vein. In addition, it is used for assessing the status of varicose veins and finding a suitable vein for bypass procedures or dialysis access. Furthermore, venography can also assist the physician to place an intravenous medical device. We shall now discuss CTA. CTA is a minimally invasive test that helps in diagnosing and treating medical conditions. Here, a radiopaque contrast agent is injected into the body, following which images of the blood vessels are obtained utilizing a CT scanner. The development of a fan-shaped X-ray beam and a multi-detector row CT has facilitated the imaging of a large volume of tissues in a short span of time. In addition to this, developments in iodinated contrast agents and optimal imaging protocols have led to a revolution in CTA imaging. CTA can be performed to examine blood vessels and organs in various parts of the body, such as brain, neck, heart, chest, abdomen and pelvis, and upper and lower limbs. In CTA, depending on the volume of the tissues being imaged and the region of the body being imaged, several hundreds or thousands of axial images may be obtained. However, going through all the axial images is laborious and time-consuming. This is where image reconstruction techniques, such as multiplanar reconstruction or MPR, come into play. In MPR, images can be displayed in coronal, sagittal, oblique, and axial planes without any loss of resolution. In addition to MPR, maximum intensity projections and volume rendering techniques are also important and facilitate the evaluation of blood vessels during CTA. The maximum intensity projection technique is capable of producing images that are on a par with images obtained via conventional angiograms. Here, the highest voxel values of a data set along a ray projected in one particular direction are used for image reconstruction. In the volume rendering technique, image formation is based on utilizing an entire volume of data within a set attenuation threshold. Based on the range of attenuation values used, the tissues can be assigned a particular color on the images. This facilitates ease of interpretation as tissues with differing densities can be assigned different colors.
You will now be presented with a learning activity.
In the following frames, we will discuss some of the commonly performed CTA procedures. Let us begin with coronary CTA. Coronary CTA is a cardiac imaging technique that is commonly utilized for the detection of plaque buildup within the coronary arteries. The cross-sectional images generated during the CT scan can be reformatted in multiple planes and can generate three-dimensional images. Compared with conventional coronary angiography, coronary CTA provides greater details of the soft tissues and blood vessels. Let's look at some of the common indications for coronary CTA. Coronary CTA is used in patients with a suspected abnormal anatomy of the coronary arteries, and in those with a low or intermediate risk for coronary artery disease, including patients who have chest pain and normal, non-diagnostic or unclear lab and ECG results. In addition, it is used to evaluate low to intermediate risks of atypical chest pain in the emergency department and also non-acute chest pain. Other indications include new or worsening symptoms with a previous normal stress test result, unclear or inconclusive stress test results, new onset heart failure with reduced heart function, and low or medium risk for coronary artery disease, intermediate risk for coronary artery disease before non-coronary cardiac surgery, and coronary artery bypass grafting. Let's now look at the benefits and risks associated with coronary CTA. The major advantages of coronary CTA are that it is a non-invasive test and is associated with a fewer number of complications. In coronary CTA, one is able to view the bone, soft tissue, and blood vessels all at the same time, thus providing detailed images of several types of tissue. Coronary CTA examinations are fast, simple, and cost-effective. The procedure is far less sensitive to patient movement. The major disadvantages are that the contrast agents used in CTA procedures may worsen kidney function in susceptible individuals. Extravasation of contrast material from the site of injection may result in trauma to the skin and subcutaneous tissues. Large extravasations can sometimes result in compartmental syndrome. Hazards from exposure to radiation are inherent to the procedure. Due care should be taken during pregnancy and lactation.
You will now be presented with a learning activity.
Cerebral CTA is akin to coronary CTA. Here, CTA is utilized to visualize the blood vessels of the brain and the surrounding structures. Apart from facilitating the assessment and evaluation of cerebral blood vessels, cerebral CTA also helps in studying soft tissues, such as the brain and the covering meninges. Cerebral CTA is commonly used for the detection of aneurysm, atherosclerosis, arteriovenous malformation, vasculitis, tumor, blood clot, tear in the wall of the artery, and stroke. It may also be performed as part of a pre-surgical workup in treatments such as surgical removal of tumor. Cerebral CTA may also be performed to establish a diagnosis in patients with symptoms such as severe headaches, memory loss, slurred speech, dizziness, blurred vision, weakness, and loss of coordination. Let's now look at the benefits and risks associated with the use of cerebral CTA. One of the major benefits of cerebral CTA is that it presents an accurate picture of the blood vessels in the brain. It can simultaneously facilitate the assessment of the brain and other associated structures. It can generate good quality images in several planes, providing greater anatomical details. Cerebral CTA can be performed rapidly and can be used even under emergency conditions. It is simple and easy to perform. The major drawback of cerebral CTA is the adverse reactions associated with the use of contrast media, which can range from simple allergic reactions to anaphylaxis to contrast-induced nephropathy. Exposure to ionizing radiations is another concern associated with the use of CTA.
You will now be presented with a learning activity.
Unlike CT, which makes use of ionizing radiations, MRI utilizes strong magnetic fields and radio waves for image formation. MRA is a technique used for the visualization of blood vessels in the body. MRA may be performed with or without the use of contrast material. MRA is usually used to examine the blood vessels in the brain, neck, heart, chest, abdomen, pelvis, legs, feet, and hands. We shall now briefly look at the principles underlying MRA examinations that do not make use of contrast material. One such technique is the time of flight, or TOF, MRA. In TOF MRA, Images are acquired in a direction that is perpendicular to the direction of blood flow in the vessel. Here, it is imperative to ensure that the repetition time, or TR, which is the time interval between the successive radiofrequency pulses, is sufficiently long to ensure that there is influx of enough relaxed protons. On a general note, TR is greater than 35 milliseconds. However, the images obtained by this technique can be quite noisy, with frequent artifacts, and the data acquisition time can be lengthy. Compared with non-contrast MRA, contrast-enhanced MRA, or CEMRA, offers good spatial resolution, rapid acquisition, fewer artifacts, and a higher contrast-to-noise ratio. Hence, these are more popular for MRA studies. CEMRA makes use of gadolinium-based contrast agents, which, by the virtue of its paramagnetic nature, brings about shortening of T1. Images can be acquired in almost any plane, and it provides the best anatomical coverage. Rapid acquisition times facilitate in obtaining images in a single breath hold, thus minimizing movement artifacts. CEMRA is now considered the standard of reference for MRA. All new MRA techniques are compared against it. However, the major drawback of CEMRA is the risk associated with the use of gadolinium-based contrast agents, which can range from allergic reactions to nephrogenic systemic fibrosis. Let us look at some of the common clinical conditions in which MRA is beneficial. The major indications include identifying abnormalities, such as aneurysm in the aorta and in the other arteries, and detecting atherosclerotic disease, which in the carotid artery of the neck may limit the blood flow to the brain and lead to stroke. It is also used to identify small aneurysms or arteriovenous malformations inside the brain. It may also be beneficial in preparing for endovascular intervention or surgery. MRA is a useful tool to guide interventional radiologists and surgeons carrying out procedures on blood vessels. MRA facilitates the evaluation of arteries before procedures such as chemoembolization and selective internal radiation therapy. It is invaluable in screening individuals with a family history of arterial disorders. MRA, by the virtue of using magnetic fields for image formation, is safer compared with ionizing radiations that are used in CT. CEMRA provides images of good quality and resolution with minimal image acquisition time. However, the salient drawbacks of MRA are that it may not be able to visualize and capture images of calcium deposits. MRA detection and evaluation of small vessels may be difficult. The quality of images obtained may be affected by irregular heartbeat. Adverse reactions associated with the use of gadolinium-based contrast agents are inherent to CEMRA.
You will now be presented with a learning activity.
The traditional catheter-based arteriography is an invasive procedure that can be performed in select patients. In patients undergoing catheter-based arteriography, an informed consent must be obtained. The procedure is generally carried out under local anesthesia. Here, following an arterial puncture, a catheter is inserted into a major artery and, under imaging guidance, maneuvered to the desired location. Once the catheter is in place, the contrast media is injected and images are obtained. In the upcoming frames, let us look at the procedure in brief. Before the procedure, the patient must be kept nil per oral for an appropriate amount of time. This is usually practiced to minimize the risk of aspiration. In addition, the site of catheter insertion should be shaved and prepped with antiseptic precautions. The arteries that are commonly punctured for the process are the common femoral artery and axillary, brachial or radial arteries. A local anesthetic agent is commonly infiltrated into the skin and surrounding subcutaneous tissues before the arterial puncture. Once the artery is punctured and the catheter is within the lumen, it is frequently flushed with heparinized saline throughout the procedure to prevent the formation of blood clot. After the procedure, following the withdrawal of the catheter, firm pressure is applied at the site of puncture to arrest the bleeding. It is essential to rule out pregnancy in women of the childbearing age group before carrying out the procedure. If, after weighing the risks and benefits, it is found that the benefits far outweigh the risks and it is decided that arteriography be carried out, appropriate precautions should be taken. This can include the use of collimation and choosing the image sequences wisely. It is better to avoid the procedure in individuals with bleeding diatheses and in those on anticoagulant therapy. Caution should be exercised in patients with disorders such as systemic hypertension, Cushing's syndrome, Ehlers-Danlos syndrome, and other connective tissue disorders that predispose patients to the risk of bleeding. Now let's look at some of the complications of arteriography. These complications can be classified into catheter-related, contrast media-related, puncture site-related, and local anesthetic-related. These complications have been tabulated on screen. Similar to arteriography, a venography is an invasive procedure that is performed for the imaging of veins. It includes direct venography, indirect venography, and intraosseous venography. Direct venography is the most common means of opacifying the venous system. Indirect venography, an approach in which contrast medium is injected into the arterial system of the area being studied, is used for examining portal venous system. Intraosseous venography involves the injection of contrast medium into the bone marrow cavity at a site distal to the venous system that is to be imaged. Complications that may occur following venography are pain, pulmonary embolism, and cardiac arrhythmias.
You will now be presented.
Let us summarize the key points of this module. Arteriography is an imaging technique employed to visualize the arteries in the body. Depending on the modality of the imaging investigation used to visualize the blood vessels, angiography can either be CTA or MRA or conventional catheter-based angiography. MRA is a technique employed for the visualization of blood vessels in the body. Catheter-based arteriography is an invasive procedure that can be performed in select patients.